to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. First thing we need to do is approve the minutes for December 2nd meeting.
Second.
Second. Thank you very much. Any questions on any of those? Well, now we'll wait for Lee to come back and start on the resolution.
Take the vote.
Oh, yeah.
Oh, yeah, let's take a vote. All those in favor?
Aye.
Aye. Thank you. All right, Lee, we're going to start right in with HS1. We're going to roll. We
Okay.
already did the pledge of allegiance.
Okay, I'm sorry.
All right.
I want to make sure I have copies for everybody. Okay.
Okay, HS1, the resolution appointing members to the Community Service Board.
Mm-hmm.
And the other, Lisa Snook Williams is in there.
Yes.
Does anyone have any questions on that? This is a Community Service Board. Background on it is the Oswego County Service Board is a statutory body of 15 members created in accordance to the provisions of the New York State Mental Hygiene Law. The board oversees the mental health, developmental disability, and addiction programs. Appointments are made by us, of course, and we'll look at full legislation at the next meeting. Any questions? May I have a first and a second on this one then to move forward?
Oh, second.
Herman Frank, thank you. Any questions other than that? All those in favor?
Aye.
Thank you. All right. HS2 is a resolution appointing members to the Children Protection Advisory Council. There are two people that we're asking to appoint. Whenever appoint of the new CPAC member and a member and the chair for that group. The Oswego County Children Protection Advisory Council was established and the membership approved through a resolution by the county legislators at the recommendation of the Health and Services Committee on March 11th. Bylaws of the Protection Advisory Council require that members be approved by the legislators to serve a 3-year term. Can I open this up for?
I'll make a motion. I'll second.
Second, thank you. Anyone have any questions on these appointments? These two here, are Darcy Beers and Brandy Kaprowski. Hearing none, no discussion, you take it to a vote, please. All those in favor?
Aye.
Thank you. All right. HS3, resolution authorizing social service reclassification of one position in the Integrated Service Division. I open this up for questions and
Motion. Second.
second. Thank you. Lee, can you go into this a little bit, just to what it is?
So this
Pretty
is
simple.
part of Hidget's team to reclass this vacant account clerk to a community service worker. It is budget neutral. It's 100% state reimbursed. It is just our way of, again, trying to make sure we're maximizing the use of the positions that we have. And so this is one of those trends that you might see coming forth with.
So that we understand this, the account clerk, it was a generic name, correct? And this is just moving the person to a community service worker
Yes,
title?
yes.
Okay. Do you have any questions?
Yeah, when did we know that this was gonna be changed and reclassified?
Somewhere at around February 13th when I don't know, Phil, we probably met a week or so before then, actually, when we talked about,
January.
yeah, January, yeah. Where we talked about our proposition of, trying to look at the structure and, what we're doing to try to streamline and create efficiencies. And so when you have positions that are vacant, some of them were eliminated with last year's budget, but there still remains vacant positions. When they're vacant for a long time, you really got to reconsider them. Do we need them, or do we need to, in this case, reclass the position to a place where it's needed?
That moving step one to step four, staying the same?
Staying the
Great.
same, yep,
Same grade, same pay?
yep.
By changing the title, she can utilize that person in different duties, but it doesn't have a financial impact.
Will it have a financial impact? after
No.
all? No, okay.
Well, that gives her more flexibility with the employee.
Correct.
Is there domicile language in the contract, what this person can do or can't do it? And that's why we're doing this?
Right, each title has duties and
Job
job
description.
responsibility, job description they can do. And he's determined that this position is better, serves as a department, and better as a community service worker than an account clerk.
And I gotta believe
I just don't wanna see us come back 6 months from now and say we need.
Well, if you recall, when Lee was hired, she was asked to take a good hard look at this entire organization. So it's and that's what she's doing. And she's coming forth with more recommendations today, and I'm sure there'll be more coming up throughout the year as she tries to reorganize the PSS.
Okay. Any other question? All in favor?
Aye.
All right, thank you, Randy. Forward to HS4. HS4 is a resolution authorizing the reclassification of 2 positions in the Department of Social Services. Lee, I'll let you take the reins on this, but I do know that this is these are existing positions, correct? And we're moving people, one person into.
It is a reclass, so what
Oh, it
we're
is.
doing is we're taking grade A and we're reclassifying that as a director of family services. So right now we have one director over the entire social services division. And looking at, some of the data that you've all been provided with regards to open cases and things of that nature and how behind in the backlog that we have at DSS, not only upstairs but downstairs as well. Taking that position and reclassifying it and moving it up to a grade A will take the protective division and the preventative divisions, creating 2 divisions, one for protective services, one for preventative services. It's my belief that this will help, again, to create those efficiencies. We had done a recent staff survey. There were a lot of complaints about staff not feeling supported. With this kind of a structure, staff are going to have more direct support. And so I believe that this will create an efficiency for our team. In addition to some of the activities that Sarah is going to report on with regards to those open cases and where we are now with trying to get our caseworker loads down to 15 people per caseworker, which is what the state recommendation is. There are some outliers of staff who's had upwards of 50 plus cases on a caseload. So what they've been dealing with out there has been pretty egregious. And I believe that this change in structure, the position had been, is very common in other counties as well, that department is 2 divisions. And so I think it's a smart move as we move forward. now that we are back to, typical services too, so we're not in the pandemic where we're back to, we don't have a lot of vacancies in this division any longer. And so I think you're gonna find that this structure is gonna be better suited to make sure that, staff at the line are getting the support they need. So that, the fiscal impact, which looks like you're interested in that part, so let me tell you about. So it's going to reflect an increase of about $4,555, but this can be filled through the salary and wage. And so I think that, again, in my personal opinion, looking at the structure, this is what we need.
And I understand that, and you kind of were given a tough task here. When did you, how long did you thought, or let me back into this a little different. The need you say is there. When did you kind of discover this? Like, you know,
I want to say probably, to get to this conclusion, I want to say about 3 months, maybe 90 days in, looking at our numbers, of course, of cases, the number of staff that we have. When you look at the number of calls that had been coming in prior to me coming in, they were between 800 and 1,000. When you look at the total number of staff that we have, caseworker ratio, I'm not surprised that we were behind. And then couple that with the fact that with how we are back to pre-pandemic numbers, that what Sarah has had to carry underneath her to be able to supervise all of those individuals is just, it's not appropriate. And so I think her having that support of having another director, again, is going to help support the staff who are stressed out. And I think the recent survey to, I keep on saying it's hot at DSS as a result of that survey, kind of putting a little spin. I'm trying to make it funny, but I think these folks are pretty stressed out when you're carrying 30, 40, 50 people on a caseload and you know you should carry 15. It spreads her too thin. And I think that's what has happened out there. We're spread way too thin, way too thin.
yeah, but you mentioned a lot about the caseworkers, which I understand. I know you have different divisions, things like that. And I've been out there a couple times under the last two directors, but that's neither here nor there. You said like 3 months you came into this, you felt that there was a need. Now you came in June, correct?
July,
July?
yeah, July 28th.
All right, so that'd be before budget time, actually before the end of budget time. Did you bring this up during budget? Because this should be handled in the budget.
Budget was due, our submission was due on July 31st.
Right.
Yeah.
Remember, we started early.
Because this should be handled during budget time, Phil. I'm sorry.
No, if I may, Mr. Chairman, no, normally I agree with you, but the circumstances under which Lee came here, we asked her to start taking a look into this department. It's going to take time for a new commissioner to come in and assess everything.
Oh, I'm not disputing that she's not working on it.
That's not what I'm saying. I'm saying that in this case, when it comes to DSS with a new commissioner who's doing deep dives into everything, going to other DSSs and seeing how they're structured, I don't want to hold her to the budget schedule like we would any other department. She's been hired to come here and do a task, and she came in at a time just a couple months before budget was due, or even 1 month before budget was due. So staff organizational changes that she feels need to be made, I think it's less important to try to hold her to the budget development schedule. Let her do the job that we hired her to do. It may be off of our normal schedule, but I think it'll pay off in the long run for it.
And then the hopes is that it's gonna pay dividends down the road. It's gonna get us back to looking like we should as a county. with the
So I've been here 12 years and we haven't made much, I know there's a lot going on. I get that. And I also respect we're a very economically challenged county. I get that. But again, this 55 number you threw out there, that number's been here forever. I mean, not for nothing. It's been a long time, regardless of pay structure or anything else.
Go ahead, Bert.
Well, I think when someone new takes over, we've had a few problems with social services. And if she can see where we can correct some of those problems so we don't have another problem in the future. It's like the DA's office, when he took over, there was a lot of problems he saw over there. We let him go and do what he had to do to change things around to try to improve it. And I think this point in time, we gotta let her run the department, and when she sees if something is deficient, she's trying to correct it, I think we gotta do it, because we don't wanna be in the same boat we have. We wanna change. We want it up and running efficiently. That's my opinion.
Yeah, I don't have the historical data for people for gobs of years.
No,
having
you should.
55
You should.
people on a caseload, but Sarah, you've been here. Is that historically true that for the past 12 years that you've been here, people have had caseloads of upwards of 40, 50 people?
I think it goes up and down. I think, yeah, there have been high caseloads. But I think, that kind of supports what you're trying to do, which is the scope under me right now as the director is usually 3 or 4 directors in another county, not just one. So I think numbers wise, it could be beneficial in really allowing us to focus on the areas that everybody finds the most important.
We were saving the good news, but I think that it's important for him to hear that. So when I came on, the number of cases, and even before I came on, at some point it was probably over 1,000, right? But somewhere, anywhere between 800 and 1,000. For the setup we have, it should be somewhere around 600 for us to efficiently and productively have calls that come in to manage it with the number of people we have. And Sarah and her team developed some systems, homework shops, for staff to come in to be able to close cases, because we had open cases from 2023 that we're going to be happy to report that all those 2023 cases were closed at the end of the year prior to this year, because had we gone into this new year with open 2023, it would have triggered an automatic audit of us, and I don't think you'd want to be audited, just in my frankness. And so with the team and the work that they've done with these workshops, in addition to a closing team that we organized, the closing, Sarah and her team organized the closing team to be able to help support the staff, again, because the support structure is not there to support these staff to be able to meet their mandates that they need to with the volume of people that are coming in. It's a pretty rigorous task that they have to complete. With this process, we are now down to roughly 700 open cases. So we are 100 open cases away from being at a place where we can level out now and keep up and not be in a place where everyone is so stressed out and working in fear because of child welfare, which is where they've been at. When you have 1,000 cases coming in and you can only manage 600, what do you think is going to happen? They're looking like Lucy out there on the line, shoving the candy in her mouth because she can't keep up with production. And that's what happened. They couldn't keep up with production. I guess we should be happy that we didn't have more fatalities than what we had with the kinds of pressure this department was under. So I give Sarah and her team a lot of kudos for coming together and being able to manage and work out getting these cases closed. So we are at what now, Sarah? And we're predicting and hoping that by when?
Hopefully June.
June, that we will be down to that 600 place. And that hasn't been done in apparently years. So we're
Since
doing...
Grand Lag, before that.
So that's been a long time. To be able to be at this place in this short amount of time is certainly due to the dedication of the staff and the teams, but also because of some of the inputs that Freddie has had as a deputy to come in to recognize, for me to come in structurally and say, hey, this is how we support this team. to be able to do the job we all know they're capable of doing, right? They've just had a high volume of productivity that they couldn't keep up with, and that's not going to be the case now. So I think it's working. I think the plan will work. And I think it's already in early stages of showing us that with the right supports in place, there's a lot more that we can accomplish.
You're not old enough to remember that Lucy clip.
Yes, I am.
I just want to say that, change is good. We talked about this at one of our meetings. We need to help her take the reins and make changes that she feels need to be done, and let her talk us through them like she is now, so we can feel comfortable. If this was a brand new position where we were creating a position that was, like in this case, the salary range of $92,000, it was brand new, we'd all have some trouble with that. But it's not. It's just a change. It requires some adjustment, and I think we should honor that. So that's where I'm at, and hoping we can get the support to move it.
Yeah, I would highly encourage this. I went on a couple ride-alongs out there a couple of years ago out there, and just seeing the stress that those caseworkers were on. The first ride stop we made was 2 previous caseworkers quit before they even got to this person.
Yeah.
And so this whole thing I believe will trickle on down to the stress on all those caseworkers that are out there in the field doing that.
Yes.
So I'd highly encourage it. Sounds really great.
Yeah, I think it'll have a positive impact on retention.
Now, is this person also going to be on the road some with her or his
It's a her. And she's
people?
been-
I don't care what it is.
Yeah.
The point is, this person's going to be hands-on with the particular individual, not just an office person, but also looking at the field, what's going on.
She's going to carry the same position that Sarah does for that division. So she's going to be the Director of Family Services, that's the title. And what is going to happen is, for this particular staff person, she's been here 30 plus years. She is somebody who already supervises the team that she kind of is inheriting, so there's already a good relationship there. It is going to alleviate Sarah of some of the responsibility that she has. So again, I think it is a good move because she is now is going to be carved off of Sarah, who's going to focus more on the child preventative services and adult protective service or child protective services. Gotta get used to the name change. Protective services, and the other person's going to be the Director of preventative services. So those services are slightly different than the CPS child abuse type cases. So I think it will help that team to streamline their efforts as well. But I think the impact is going to be much larger on the CPS adult protective side, just because of the scrutiny and the priority that those cases take. Does that make sense?
Hopefully in 3 months, you'll come back and give us some good positive
Yeah. Oh, yeah. Oh, yeah.
results.
Oh, yes.
Okay. All those in favor?
Aye.
Okay. HS5, resolution awarding professional service contract, RFP 24 DSS 009, Oswego County Purchase Preventative Services. Background on this RFP is a renewal of a previously awarded RFP. The County of Oswego sought proposals from qualified child welfare agencies interested in providing preventative services in the Oswego County. Proposers interested in providing these services were interested to respond to the request. It is Oswego County's intent to select a proposal that provides best solution to the county's needs. Preventative services are designed to strengthen families' ability to function more effectively, independently, and to prevent the foster care placement of children, and to reunite as soon as possible if any placement is necessary. These services are supportive and rehabilitative. Okay. Now on this, can I open it up for the first and a second here? We'll open up for discussion.
Move it.
I'll second.
All right, second. Okay. Go ahead, if you'd like to speak to some of this, I'd appreciate it.
Sure. So these are the four people that submitted, and Liberty Resources is the current contractor that we have been using that has been 90% successful with their outcomes. Bless you, in serving our population. I think that what you're going to find is that Liberty Resources was, I think, ranked at the top candidate here. And I think that's a result of our relationship and our history with Liberty Resources, that they are prepared to manage the 105 cases that we have. They do not have startup costs. I think the concern with ICANN, although I feel like this is a very competitive bid here with their background as well. But I think that what will inevitably happen with ICANN, as did with Liberty, is that ICANN is going to need to circle back around and ask for some startup costs here. They're going to need additional staff to manage. They only have 6 caseworkers that are in their plan. Liberty Resources has 12, which really readies them for the additional cases that we have. Unfortunately, this is an area of growth in our community, and I think that's my only concern with ICANN. I think it's a great organization, saw a lot of great youth services there. I think our concern as a team is their ability to manage the number of caseload and the transition phase. Liberty Resources has a track of 100% of the kids are not placed. That's pretty significant for us. Sarah, do you have anything else to add? I know I had some notes here.
We've worked extremely well with Liberty Resources, and we'd like to continue to be able to do so. They meet our needs. They participate in our critical thinking sessions. They're well established in our community with school districts. So
they also use our Traverse system. So I think the other downfall for us with regards to our scoring process here was that ICANN would have to get up to speed, which would mean more work on our part, more expense on our part to have to find ways to share electronically confidential documentation. So when we kind of played out the lowered expense, that's because they haven't actually been providing the services. You can see from the other bids, they're much more in line with where they would need to be to support the volume of work and casework that we have. So, yeah.
So is it your understanding that if we were to award to Liberty, they would incur additional expenses that would drive that number up to probably closer to what?
No,
the
I think
cost
that's
is?
true of ICANN.
That's what I mean.
Yeah.
If we were to award it, I
Yes.
think that 699,000 would actually, in reality, be driven up to closer to what the other cost is.
Yes, because well, I don't know about have to, but what's nice about Liberty Resources is they already have connections in Traverse. Those are systems we use, so we can communicate electronically with them confidentially. If they didn't have that system, or it needed time for them to get training and be trained, that would be exhausting for us to have to. That would be a challenge and hardship
It would
for us
pull your
to do
staff
that.
away from.
Yes,
Okay.
it would also mean there would be a 90-day lag transition, so families would go without services likely. I don't know what the negative impact of that could look like, but I think those were our gravest concerns with them. Again, looking at them on paper, they look great. They look really great. Like them as an organization, feel like they could be competitive. However, we do have the outcomes of the current people that Liberty already serves for us, and when you have 100% rate for the keeping the placements down, I don't know how we argue with that outcome. That's pretty good.
Lee, I apologize. There's only 6 caseworkers in the Liberty budget as well.
Okay.
So that is
I was going to ask
Okay.
if ICANN was calculated at a lower staff.
Okay.
No, but there's no startup cost.
Okay, so they have the comparable staff. Do they have a director and a manager and a senior caseworker?
Yes.
Okay, so maybe that's where I was thinking it was higher.
Questions? Now, I have one question. Now, as these cases, let's say the caseload goes down, does that number go down as well? So in other words, the contract, they're not gonna be, the contract could go down.
I don't foresee the number of cases going down.
Well, it's just a wishful thing.
Yeah, you know, if I look at the trend of how we've been moving over the past couple of years, it's just climbing.
Okay.
Yeah.
So when we're confronted by our colleagues on the cost difference and
Yeah,
the fact that it's a
yeah.
1% scoring difference,
Yeah,
we can say fairly definitively that the expectation is that there would be significant additional costs that aren't accounted for in this proposal.
right,
Okay.
exactly.
That would bring us to a more comparable number.
Yes.
Okay.
Plus a very taxing, I don't know.
Because of course it looks,
Mhm.
And the time-wise of the 90 days.
and having a period
Yeah.
where we're unable to provide.
The disruption of service could be quite
Yes.
costly.
Yes.
Are there penalties related to something like that? No.
Sarah?
Oh, okay.
No,
Is this a fully discretional program or is it a mandated service?
it doesn't have to be mandated through a contracted agency.
Okay.
But given the fact that it prevents foster care placements, it probably pays for
But
itself.
there's no explicit penalty for not, okay.
Any other questions? Yeah, do we bring this to a vote then in terms of moving forward? Everyone on board? Okay, thank you. HS6, resolution awarding professional service contract RFP 24 DSS 010, process server services.
Move it.
Move it. All right. Can we bring this
Make a
up?
motion.
Make a motion?
Okay.
Second? All those in favor?
Aye.
Aye. Very good. HS7, resolution authorizing budget modification of mental hygienes, accept state aid allocations for court-based mental health navigation initiative. Background on this, the New York State Office of Mental Health provided Oswego County with an opportunity to establish a court-based mental health navigator program. The following submission is approved for implementation of plan. The division has been awarded $199,677 annually, beginning in January 1st, 2025. So this is just a matter of us accepting funds. I have an motion first and second. All those in favor? Aye. Thank you. HS8, resolution awarding professional service contract RFP 24 MH005, housing rehabilitation incentive management. I'd like to at least get some discussion going on this, so if we can open up the move it.
Make a motion.
Second it.
Right?
I have Nicole here. This is her division, so I'm going to let her speak to it.
So this is essentially a pilot project that we put out to RFP using blended funding sources. So we'd be able to serve a broad range of individuals. The intent for this service is to try to fill a gap in our continuum of housing support needs for individuals who are housing vulnerable or homeless. Based on some multi-stakeholder work groups, we were identified that while there are existing services of different types that are serving the homeless, Housing First programs that prioritize certain groups of individuals, and there's a void or gap in the continuum of services where basically what we have is like putting out all the fires. All the highest need, most critical individuals related to housing are who's getting the services and the programs. What we don't have is people who are housing vulnerable or homeless, have some financial resources, but need support and assistance to be able to make a move and obtain and secure stable housing. So this is to target that group of individuals to support them folks that have a degree of readiness to be able to move forward successfully, because they have been sort of down here, but wherever the services are being provided to folks that are up here. And so we're trying to get at a population of people who are ready to make a change but are not able to move forward without some support and maybe some additional financial resources. So this is testing that out to see how successful this can be with helping those individuals and or families to be able to secure housing, retain housing, and stop the chronic cycle of homelessness.
So now, this RFP, is it a, is this for how many months term? Is this a 22-month term?
Yes.
And financial or fiscal impact, 40%. New York State, 45% opioid settlement, abatement funds. Is that the 199 we just received? Is that what we're?
No. No, in the budget modification, that's an RFP yet to be developed and released. This is an entirely different project for funds that are already in the budget.
All right, and we'll have 15% will be local share. So this is already built into the budget.
Yes.
Have any other questions?
Yeah, I'm sorry, you did a good job trying to decipher this. I'm a little confused here. You're saying this is for the homelessness, right? Or the people who don't have a place to stay, whether it's, well, there could be a million reasons. I get
Right.
that. Does this work with the people that are homeless that will not get off opioids and all other kinds of different problems, or mental health people, or from my era, the Vietnam War remnants? Which group are we, or what group are we trying to get to?
It's broad as far as those kind of characteristics. It's very broadly open. Really the criteria to being able to be served is you need to be homeless or have an unstable or unsafe housing situation, and you need to have a financial need to be able to have support, and you need to not be enrolled in some of the other existing housing services, because we're not looking to duplicate anything. We're looking to fill a void where there are people who are not able to access certain services or financial resources for housing. So any of those categories of individuals, but one of the most important pieces of this is the individual needs to have, there'll be an assessment to determine that individual's readiness to make a positive change, to be able to be successful with that. So just being homeless, there are other programs that serve individuals that are homeless, regardless of any other factors. This is looking to serve people who are really need the additional support to make a positive long-term change, and there's no support available for them.
Because many of our homelessness, they're veterans that get a dispensation from the government, or they're people that have mental health problems. Many of them are retired and do get a pension, or not a pension necessarily, but get Social Security. I mean, it can't be one paintbrush, I can tell you that, because they're moving into Saratoga, they're coming into Glens Falls, and that part of the state I'm a little more familiar with, but that's neither here nor there. Why?
There is the component of this is that there is some financial resources if somebody needs them. It's what's called the declining subsidy program over a 9-month period, where so the individual would need to have some of their own resources, so the amount would start out higher and decrease monthly to the point where then the stipend, rental stipend piece that they're getting is zero, and they have to cover, so their contribution to paying their rent increases as time goes over, and the stipend is eliminated. So it's not an ongoing forever support. It's for individuals who are going to be able to manage that. So it supports them during the transition, but then the expectation is that they're going to be able to pay their rent. So
Do we have people auditing this and checking in on these individuals and on and on and on?
this program has a care management component to it that will work directly with the individuals.
And do we utilize that component?
Well, it's a brand new service. We haven't started yet.
All right, because there's a fear, and it's happened in one of our neighboring legislative district, and it's happened in mine. People squatting all over us. and I need all of it. So I want somebody from your office verifying where these people live, going knocking on the door and say, hey, you live here, don't go unarmed, I'll say that. But the thing is, I want a good, solid follow-up on these people, that's all. Because it's costing all of us money. And I don't know how
We
the
do
groceries
track
been in your
that.
house, but it's getting tight.
Yeah, and it's gonna get tighter, right? They took that
Oh,
back.
absolutely.
$863 more it's gonna cost us out of our pocket for groceries. But I think the population that they're targeting are the people who aren't necessarily falling in the category of where I think you're speaking to. They're the people who just need a little bit of assistance to be able to get it to the finish line. So it's not a long-term program, but it's a program that is clearly needed in our community. When we're ranked one of the 10 top poorest counties, we have to consider these types of options for people so that we're not just catering to the biggest need, right? We need to make sure there's a step up or step down process for people to graduate, so to speak, with a case manager. And statistics show that when case management is involved, the outcomes are greater and better
And that was my
because
point,
they're getting the support.
because I want follow-up.
Yes. Mhm.
Yeah, so there's case management included in this program. And when this program is coming to an end with somebody, if they're going to need ongoing support, they would make those referrals to other care management services in the community that are more long-term care management programs.
So it'll be monitored and will be reported back in terms of how the program is working and whether it's successful.
Right.
Yes.
Right. And that's because it's a pilot, we're going to be looking at it very closely to see, number one, who is it that we're serving, and who are we successful with this program, and maybe we need to do adjustments, or maybe it's not what we need to be doing. So it's going to be a process that we're going to be watching closely, working with. Well, our recommendation is that it be awarded to OCL, so we will be working with them very closely.
Is there an outreach or recruitment element, or is there already a large population of people that you are aware this would serve currently, that maybe they look for help and there's nothing available? Is that really who it's for?
Yes.
Okay.
Yeah.
So it's people that are actively looking for support. They come, they seek out services that aren't available. This fills that gap
Yes.
and provides that. Perfect.
Anything else? All in favor?
Aye.
Thank you. Yes, 9. Resolution awarding professional service contract RFP MH006 opioid abatement recovery support and services. Going to open this up. We have a motion. All right. Background on this: New York State provides provisional mental health hygiene local government units for Oswego County with opioid supplement regional abatement dollars for the LGU to fund the services and intervention based on the allowable use of funds for settlement and status. The identification of local priorities has been guided by the mental hygiene local services planning process, including engagement of the community and stakeholders for input. There's a high need for focus on community-based services, resources, and support substance use, recovery, and health-related social needs. So I'd like to open this up now, if we can, to see if there's anything else we have. Anybody have any questions on this RFP?
I'd appreciate an overview similar to the last bid.
Sure. So the RFP was not asking for any particular service in general. It was playing out what some of the needs were that we were identifying and asking for proposals to address those needs. So the review committee selected the proposal for Oswego County to open, to expand and really operate a recovery center. So currently that organization operates a small recovery center in the city of Oswego with some space that was donated by the city of Oswego. So their proposal was to really be able to be funded to provide a full-time recovery center, which would be located in Fulton. This is, we also, in this RFP, we asked that the services be provided in the space that the committee approved that the division lease from Catholic Charities. So this service would be provided in that space that we've leased in the Catholic Charities building in Fulton. So they will be open 7 days a week. Limited, the hours would be limited on the weekends, but would still be accessible to people. They would have flexible hours based on some of what their programming assessments determine meet the needs of the individual seeking services. People would be able to go there and be able to access a variety of supports and services. They have partnerships identified with other local providers to provide groups, some assessments, linkages to other services, certified peer support services for individuals who are struggling with addiction. They have linkages with Department of Social Services related to other financial needs, basic needs. They would be able to access some basic hygiene and food necessities if they're homeless. They would be able to be linked to some of the other programs that we're all funding for those individuals in need of those. Have access to, their plan would be to have access to some computers to be able to do housing searches and some job development support. And in general, it's going to be a welcoming place where people can feel supported and whether they're in recovery or new to recovery and don't know where to go or where to get started. This would be a center where people can go to get that guidance and that support from both professionals and from peers who are already in recovery themselves.
And the peer support programs have had a lot of success. That peer-related type programs is very successful.
Do you know what types of professionals would be on staff at the facility, at this location? What professional individuals would actually be contracted directly, not just be referring people to?
Who would be providing some services on
what
site?
types of positions?
Yeah, I can talk about that.
Certification process,
Yes.
don't they?
Yep.
So they go
There's
through
a state
the
certification process. So they would have staff from,
And the reason I ask is because $175,000 for just a referral service would be a lot of money. So to be able to confidently say there's actually going to be professionals on site providing necessary services instead of just referring would be helpful.
yes, so they will have, on site, they will have certified peers that are employed by Farnham Family Services that are from both Farnham Family Services and the Prevention Network of Central New York. And they would be able to do assessments as well as linkages. They have plan to have a RISE staff from the Independent Living Center be able to be present. Not that everybody would be there full time, so they would have scheduled different activities and dates. Prevention Network would be doing prevention education and naloxone training and offering recovery support groups. Farnham would also be doing substance abuse screening and referrals to services.
So they would be subcontracting with Farnham?
They actually wouldn't be subcontracting. These are partnership arrangements that they're already in place.
Even though they were competing bids, they
were competing bids for entirely different services.
Okay.
Mm-hmm. Yes, so these are partnerships that they're not paying for. There will be salaries for staff to operate the center, but these other partners with other agencies, this is work that those agencies are doing around in the community already, and this gives them another dedicated space to be able to provide those services.
It seems like, someone like Farnham could have potentially come in at a lower value if they're already going to be involved in the process in such a way, but if it's not a service they would charge for, it makes sense. That makes sense. Okay, thank you.
Any other questions?
this service is just offered in metropolitan downtown Oswego.
Right now, they have a site, yes, that's in downtown Oswego. It's open to anybody, but you have to,
Yeah, but it's tough if somebody from Redfield comes
yes.
and especially on weekends. But that's your, generally statistically, one of your most difficult times, but
Right,
an individual, it's,
right. When everything else is up, it works off of business hours, normal hours. So this will have some evening and weekend availability.
Now, isn't this moving to Fulton, that you said?
They're gonna maintain separately, they're gonna maintain, their part-time site in the city of Oswego, but their full-time site will be in Fulton in the cafeteria's building.
One of the things I know that takes place is there's a lot of rides available that take Fulton from the north. They need to get to Mexico to do it, but yeah, that's a problem. That's a problem. I don't disagree, but I know that's being worked on.
this problem just isn't as strong, if not even stronger statistically by population in your remote areas. Because there's nothing else to do there. I mean, it is what it is.
Anything else? All those in favor? Aye.
Just to add to the transportation issue, while I don't have, a transportation option for the evenings and weekends, which we struggle with, people struggle during those times greatly, and that's still something that we're looking at. We do have a contract that with the individuals wanting to get to this location during the regular Monday through Friday up till like 7 o'clock, they would be available to use that to get to this location.
No, I can appreciate it. Addiction's a very, believe me, I could write you a book about it. The thing is, it's a very difficult thing. The problem is the mentality. Yeah, remember, the mentality in this county is day and night from the riverside here up to Salmon River Falls. Completely different mentality. So you've got to break that.
Okay. Thank you. Next on the agenda is the HS10 resolution establishing capital project C0125 for Campalis Electrical. Ryan, I'll let you.
So when we got the CFA grant in 2019 to do all the things in the main lodge, there's electrical work to be done in there to obviously work with the upgrades and additional work that was done there. And this is to complete that project that over the time period it took to complete the grant with COVID, basically shutting it down for 2 years with costs, with everything. This is what we believe it will take to complete the electrical work.
My understanding too, I read some of this, that right now the way it's set up, it's kind of taxing the heavy equipment, heavier users out there for you. Is that?
Well, yeah, I mean, it's the system, the current system out there is definitely dated, and this needs to be done.
So, I mean, the sooner it gets done, the better off it'll be for that equipment. That's what I'm trying to say. I'd like to open this up though.
If you gotta finish, you gotta finish.
Okay. Any motion? Any other questions? All in favor? Aye. Thank you. Okay, now I'd like to get into committee review. County Youth Board.
Okay, so the bylaws, what we did is you're aware that the city and county no longer are together as a youth bureau, so we're just the county youth bureau now. With that being said, Rick, as the county attorney, looked at the bylaws and basically provided updates, removing language referring to the city, making some changes that brought us more up to what we currently are. There was no reduction in anything along the lines other than maybe changing the number of board members so that, we need to have quorums and things to that matter with the city not being involved. We reduced the number of board members by a few. To note that the city had appointed a alderman to be on our board. That person is staying on our board as an at-large member. They wanted to stay on, so the city still has that piece involved, but really the changes are mainly the language, just to bring it up to par to what Rich felt was sufficient. This has been run past my board of directors already with our in approval of it, but the next step would be for getting your approval so that I can have the chair, sign off on it.
All right, so this is something we're gonna need to do a vote on, the group probably, so
I think so.
let's, and all those in favor?
Aye.
Mr. Chairman, I need a first and a second.
First and a second to,
So moved.
I'll second it.
Thank you.
thank you.
Wait.
Is that it? Is that
Oh,
all?
you want me to give my updates? Well, I'll be quick. So, just for time, I'll be in Albany tomorrow. I have 12 youth from the county that are going up to the Youth Leadership Forum. Actually, they're currently there. They went today with one of my staff. They're a part of a program put on by the state where there's programming by our young people who will be there to work together on different things happening. And then tomorrow, we have meetings with Assemblyman Barkley and Senator Waldwick. I gave each one of you a handout of different talking points about what we do at the Youth Bureau, so I won't go into that. You can read that if you have any questions. A lot of information on there. Everything from what you do internally or contract out, grants that we receive, different things that happen. And then I'm going to pass these out while people are talking that no, I'm not burning all the toner that the county has. This is different shows that are coming up and events that we distribute this information to. I have it all electronically if anybody wants additional information. But this is basically who we're hiring, or we have a lot of positions we're hiring, as well as offering, listening. It's advertising some of our summer camps that we have happening. I will tell you quickly too that just some quick updates. Up at Legends, as you well aware, we have a contract with the Oswego City School District. Believe it or not, they're supposed to be able to hit the fields about a month from now, right around St. Patrick's Day. As it looks like right now, they're having all their spring baseball and softball teams, aside from the varsity, participate up there. So we're anticipating 5 teams daily practicing or playing up there. At Camp Zerby, we are just waiting for, well, 2 things. We don't want the snow to completely melt because we're building a snow maze out there. But once it does melt, we have the disc golf that they will come in. It's confirmed. They are just ready to come back and put them in the ground. All the clearing is done. They were not able to get them in the fall based upon, tell me if you've heard this before, but deliveries being delayed. So by the time that the equipment got here, they weren't able to get them in the ground, but they are ready. We have new basketball hoops that have been delivered. They'll go in the ground too. New pickleball courts are done, and they'll be put up once it's all finished. So we will have a whole bunch of new activities to offer at Camp Zerby, as well as what you'll read through here. And at Camp Hollis, over spring break, not winter break, but spring break, we will be offering again another camp during the week, so that day camp, so that while kids are out of school who maybe don't travel anywhere, will have a place to go. And with that heated building, they will be able to go whether it's snowing out or a nice springtime, and we'll offer activities for kids to be there during time when it's out. So there's a lot happening, so you can read about it. I know that for time restraints, that if there's questions, I certainly can answer them, but if not, I don't want to read you what. Questions? I know Legislature Durden likes to take all this extra paper with it, so, but we are looking though for staffing in multiple positions, so if anybody's reaching out to you regarding open jobs, with some of their quite a few jobs that we have available. We'll fill, but there. Oh, one other last quick thing, Jack sent me a text. Right now, he has 114 kids signed up for Camp House as of today. Camp Zerby's registration and is just opening up, and Legends Fields will open up next month when we confirm a few things with the health department. But we anticipate we'll fill all of those spots.
Okay, I kind of went out of order here, so I guess I have some more committee review and discussions. Appointment of members to OFA Advisory Council. That is,
Yeah, there's a handout in our material that explains that. That's for Ann Miller and Catherine Hogan.
Okay. That,
Well, we're gonna get back to the
there you go. FA Advisory Council was established by the Oswego County Legislature to provide provision Title III, the Older Americans Act 1965. The purpose of the Advisory Council is to oversee the direction and development of the Office of the Aging, to establish and maintain programs and service for senior citizens of the Oswego County. Appointments are made by the Human Service Committee of the Oswego County Legislature for a term of 3 years. The Office of the Aging would like to recommend the following two reappointments to the Office of the Aging Advisory Council, beginning April 1st. Ann Miller, reappointment. And then also Catherine Hogan was a reappointment. Any questions on those? We do need to take a vote on that, so I'll open that up. Motion? Second? All those in favor?
Aye.
Thank you. Okay, the next one was a prescription medication disposable drop box, new at Bunner Street building entrance. I don't know if there's someone here to speak to that, or if that's something.
Sarah.
Pardon? That was Sarah as well?
Yeah, that's a prescription, unused prescription drug drop box for senior citizens to dispose of their unused prescriptions.
Looks like Barnum Family Services of the Oswego County and Prevention Coalition received the funding from the Substance Abuse and Mental Health Service Administration for a strategic preventative framework partnership to succeed, or to success for communities, local government, universities, colleges, and tribes and tribal organizations. So this will be located obviously up at Bunner Street at the entrance. Any questions on this one? Is this one I need to open up for a vote to have that drop box placed? All right, so I'd like to open this up to the floor.
Yeah, you just like a motion made in a vote to approve the placement of the drop box at the new OFA entrance at Bunn Street.
Okay.
And it is, I did ask, it is a secured box, so that part of it is the key. They come in on a periodic basis to empty it and make sure that the drugs are disposed of safely and appropriately.
Who opens that box?
It's part of it.
Barnum.
I mean, people who come in and dispose drugs.
Right.
Who opens it? They're gonna be there all the time? A locked box.
Yes, yeah, that a senior citizen
Like a
can
mailbox.
put their
Roll
own,
it
yeah.
down.
Yeah, I know,
Yeah.
but when I took mine to the pharmacist had to come out and unlock the box for me to drop it in.
I'm
Is that
not
like a
sure.
box?
This may have its own flap door that you
Yeah.
can just
Yeah.
drop it off.
That's what I was wondering.
Yeah, they have just like those chutes.
That's what I'll be
Once you
able.
drop it in there, you can't get it back, kind
Yeah,
of.
I'm just saying, when I was with the pharmacist had to come out to unlock the box. and drop it in.
Was this, was the design of the box reviewed, because this is, you know, a newly renovated facility, maybe we don't want to send the wrong message.
I think Sarah told me they do this at another location already, so she's familiar with the box.
Okay.
So I didn't see a design of it. It's the same thing that we already allow. I'm trying to remember where she told me we already have one. Can you?
There are actually, I mean, I don't know if they're all monitored by Barnum, but there are several throughout the county, and some, like Oswego City Police Department has one in their lobby as well.
Okay.
Sorry, managers, those if you have questions.
Oh, okay. Excellent.
Yeah.
Thanks.
And I made a note that we can bring that up next month at our meeting as well, so we can at least get a description of the drop box.
Yeah, just to see, you know, since we're putting so much money into that facility, it might be nice to understand what we're adding to, so that when people go to the facility, the first thing they see, we have a little bit of understanding and control over what that is.
Okay, so can I open this up for vote? Motion, second? Herb? All those in favor? Aye. Thank you. Okay. Now we can go back to, you've already finished up your recording. Let's go to Veteran Service Department. Okay.
Okay, so this will be kind of short. In 2024, every year at the beginning of the year, I like to do last year's numbers. Last year we served over 1,000 veterans, 1,600 interactions, that's phone calls, people stopped by. 272 claims were submitted and over 2,600 documents. We were able to get $318,286 in monthly payments for the veterans through filing these claims. The retro payments, we were able to get them is $761,234 for a total of $1,079,520, which is a little higher than last year, I'm pretty sure. So we did really good. We're still running about an 80-85% success rate. The VA has gotten harder. PAC Act has really changed a lot of stuff. The presumptive conditions used to be that presumptive. They were real quick and easy, and those are now starting to be more difficult. So we're doing a lot more supplemental claims and higher level reviews, which tend to take a lot more time. I did lose a guy. I mentioned the last time that the state had a position opening up. Horton got hired, so now there's only 2 of us. I started the hiring process. HR has been wonderful in helping me out with that. So currently we have 135 open claims for just the 2 of us in that office. So I'm hoping to get somebody in fairly quickly because it takes at least 6 months just to get them completely trained up to where they're a veteran service officer. And until then, there's not a whole lot they'll be able to do other than over-the-shoulder Matthias and I, so they can learn the process, and learn how we use our program, how the VA's program works. So hopefully, middle of the year, I'll have somebody that's all spun up. Right now, I got 2 people that have applied, because you have to be a veteran in order to be a VSO. That's not 100% true. We are accredited by the VA, but in order to get accredited, you have to be sponsored. And our county is sponsored by the American Legion. The American Legion requires that individual to be a veteran. If we were to get sponsored by New York State, they wouldn't have to be a veteran. But if we were to go that route, all the veterans that we're working with right now, we would lose access to their information until each one of them signed a new document changing over from American Legion to New York State. So we just have to leave it the way it is. We had a list of people that had applied back when they tested, and only 1 person on that list of 7 was a veteran. So we had to resubmit the job application, and I've had 2 people reach out to me so far. So I'm going to start doing interviews here within a week.
Good. Hopefully that'll be filled pretty soon. Okay. Move on to Office of the Aging. Anyone here to do that one for us? Okay. So, Department of Social Services, updates?
Everybody said it takes so long, and I heard people saying they want to get out of here, so I'm going to try to talk as fast as I can. I'm going to start with the stats and updates. Just administrative and staff development updates. All line staff and managerial focus groups have been conducted. It took us quite a while to complete that. A building of 344 staff doing focus groups. It was a bit of a challenge getting everybody in to be able to complete that quickly, but we did get it done. And I think the top areas were for communication. Oh, Sarah, you just missed it. You could have gone. All right, well, now you're going to have to listen to Sarah.
Read the agenda, I'm sorry.
Oh, that's okay, Sarah. We missed you. Good work. So poor communication and lack of training, I think, were the 2 biggest things that came out, and I feel like those are probably always part of anyone's strategic plan, is to more transparency, communicate more. The Commissioner's Office began monthly munis meetings, inclusive of members from Audit, Treasurer's Office, IT, Fiscal, Purchasing, and a Tyler representative there. We believe that these collaborative sessions will prove helpful in creating some efficient solutions in overcoming some of the barriers that I think have been there for a while, but we just haven't really gotten organized about it. I'm looking at Veronica because she was there. And I think you felt it was useful too. I think it was a good collaborative and we should continue doing it and see what else we can get from it. Yeah. So, I did meet with Mary Curcio from Victory Transformation and Harper Gray Properties to discuss both emergency and long-term housing solutions. Harper Gray Properties will look to present at a future committee meeting here to share with all of you some of the proposals that they have in mind. They have a lot of money, so I didn't want to pass that opportunity up. When they throw out budget numbers like $50 million, I tend to perk my head up and listen a little bit, so I'm hoping that maybe there can be some collaborative work done here with this group. In continuation of procedural review, the Commissioner's Office has updated and submitted their emergency closure procedure to the County Administrator's Office. This procedure addresses all co-op staff in the event of a closure, which was not previously noted. Temporary remote work plan was also proposed, given the lack of sufficient parking and space at the Department of Social Services. We also are meeting and continuing to meet with After and O'Connor monthly to work on data-driven decision-making processes. So when I hear you talk about outcomes and wanting additional data about the services that we are contracting with, this is one of those things that we're doing to ensure that the outcomes we expect to get from people we contract with are in fact the outcomes we want from the contract. So this group is helping us to achieve that. The Commissioner's Office has continued conducting bi-monthly labor management meetings to address key points of pressure and concerns among staff. That has been going pretty well. Staff Development Coordinator presented personality dimensions at last week's NIPWA Winter Conference and had such an overwhelming response. The session had to be expanded into more conference center and out in the hallway. So there was it had a great attendance, so we're proud of that. So we have the staff updates by department. The numbers are there, you can review them. I'm going to kind of skip down to the comments to get to, some of the pressure points. Heat began on 1/2/2025. The extreme cold and wintry conditions have created a large influx of incoming calls. The team is behind. There have been some, bless you, staff shortages and seasonal vacations that have increased the backlog. I think at Thanksgiving, the team was on vacation. Someone didn't know how to turn off the call center, so that resulted in an additional 600 calls that normally wouldn't come in because the system's closed during the holiday, but because it remained open, we had additional 600 calls come in, which really created some backlog for the team. And really across all the programs downstairs, we've had some backlog with the chronic Medicare programs, and we are working at finding some strategic options to help those teams get ahead of that backlog. And we're hoping that too, Gidget did present at NIPWA as well on EVA. We still are working out some issues with the phone system. We are looking at alternatively using their 1-800 number rather than the 963 number that we have. So we're looking in that option as a workaround until we can kind of figure out with our provider how we manage the issue. So they're also talking here about using EVA to provide mandated rights and responsibilities verbiage for SNAP interviews, but we did learn at our last directors meeting that there are other capabilities that other departments and teams could use with the EVA program related to policy and procedure, making it easier for staff to ask questions, again, to support the team needs to be able to be more efficient. And so we are going to be getting a presentation from them in the coming weeks to see how that application might work elsewhere at our building. Moving on to DSS stats and updates for child support. They do have some vacancies. They do have a new child support staff person starting in January, but they're also losing one. So again, we continue to have that vicious cycle. As soon as we get them in, we've got somebody moving on. Some of the updates there, our child support unit has collected $14,847,208 year to date. That is an increase of $632,712 compared to 2024. I think that's a typo. As of 11/30, or 23, sorry, that's not a typo, but this is 2024. As of 11/30/24, $212,426 has been returned to the county for past assistance reimbursement. Total calendar year collection for 2023 was $207,778. The division has already exceeded that for the 2024 calendar year. 91% of collections went directly to families, 9% went to assistance reimbursement, and 0% went to medical support. We did include some fiscal information, fiscal service eligibility staffing. As of 1/6/25, there is one vacancy. Services eligibility unit has 2.5 vacancies. I just want to see if there's any comments. I think the numbers are good. Numbers are weak. Sorry, folks. So deadlines have been set to have all 2024 claims submitted to ACS by 1/15/2025, so that all 2024 claim reconciliations can be completed by 1/20/2025. Lori will monitor this. The below deadlines have not been met, so you can see where Lori started tracking this information for me because we were, we wanted to understand that we can get our claims in because that's revenue that comes into the county that when we're behind, we're not seeing, and that's problematic. So we are trying to figure out some solutions on how we can get on top of that. Lori, did you want to add anything with regards to that?
I can add some updates that the majority of the October claims have been completed. I'm still waiting on one, and they were finished on January 23rd. The October reconciliation has been done. The November, one of the claims was finished on January 16th. The other set of claims, it was finished last Friday, -1 schedule. The idea is that the state deadline is to have these claims done by the 20th of the month following the month that you're doing the claim for. So for example, December 24's claim should be completed and submitted to the state by January 20th. And our claims are not being filed timely. So I'm working on a plan. We have additional training that's going to be happening so that we can break down some of the tasks that the people who are doing the claims and responsible for those take some of their caseload away in hopes of giving them more time to get these submitted timely. Part of the munis meetings that we've also been having is to help develop reports that can gather the information that's needed for some of the claims that are being filed. We have to gather a lot of information from munis, and the meetings have been helping as far as developing reports that can simply be pulled to say, yeah, this is what we paid in payroll this month, this is what we paid in mileage this month, so that those figures can, as soon as they're able to verify that data, we can get the upfront information to process the claims quicker, then hopefully we can start meeting these deadlines. But until they're met, we run the risk of losing money, losing reimbursement.
Thanks, Lori.
You're welcome.
Last but not least, is our DFS stats. I'm just going to hand this over to Sarah just to talk a little bit. We did talk a little bit about the closing themes, and maybe, Sarah, you want to maybe talk about how the staff are feeling now that they can actually see the light at the end of the tunnel, that they are feeling like they're getting to a better place. Sarah?
Yeah, we developed a very specific process for this. for the case closing team and involvement with the case closing team. So we have an ongoing schedule of caseworkers who are moving through the process, and those who have gone through it, they have, they're coming out with a caseload of 5 or 6. So then we're being really clear on what our expectations are going forward, to make sure we're working smarter, not harder. We're maintaining our quality controls. So we're making sure that we're meeting all of our state mandates and assessing thoroughly and properly. So we're very hopeful, like Lee said, in June we'll have reduced caseloads and continue to see success with this. So.
Yeah, so I just wanted to highlight some of the service updates. The team has been really working well with the challenging weather conditions that we've had. I feel like the weather's been sitting over Mexico for some reason. We're just getting dumped on there. Sobriety treatment and recovery team start also continues to work towards fidelity. I don't know what this ABT Associates is. Is that a typo, Sarah, or is it ABT?
It's APT.
ACT.
Yeah.
APT.
B. ABL.
ABT.
Yeah.
Associates is communicating with OCFS regularly, the ability to assess data. The team remains dedicated to meeting fidelity standards, and they've worked hard with their START partner farm to hire for the last 2 family mentors. What's really great about this program is that although it's not a large program because it is pretty new, kids are returning home much sooner than traditional type services. So when we talk about the difference between child protective services and child preventative services, this is the type of program that makes a difference. And it also helps with placements, preventing placements for children. So we've had some really good outcomes. And again, this is one of those peer-supported programs where people who've been through the system help support other families who come into that program. So we've had some great success with some of the peers that we're using and the outcomes for the family. Yes. Sarah?
Maybe you want me to hand this out?
No.
Oh,
Kevin, excuse me just a minute, Kevin, I'm gonna need to go, I have to go to, so if you could take over. We have Sarah left.
Yes, I do apologize. I
Okay.
didn't look at the agenda to know there was a time change. I thought it was early.
All right.
That's again. Okay.
Me?
Yeah.
Are you, say to me, there's still some parking issues at the SS, do you want to let the community know what's been happening out there this winter?
So that was very successful, very welcomed by the staff out there at DSS. The overflow lot, I think there was some concern in the summer that staff weren't using it, but once it was phased in line, staff are using it. With the addition of all this seasonal snow that we've been getting here, the snow removal and the plowing has been kind of tough, so we lose lots seasonally, spots to park. I know Kevin came out and visited and you had a little bit of a hard time finding a spot as well. We all find that challenge. Nervous today that when we head back, it will be slim pickings to find a spot. Cycle of abuse where we're driving around looking for someone to leave so we can pull in. So I think that, we still have to address some of the parking issues that continue to happen there. And I think folks are being as patient as they can be. I think the snow just kind of exacerbates it now with needing to have snow removed from the lot to open up some of those spaces. But hoping that as we come into this, better weather, that we can, continue to have talk about the space, even space inside the building is pretty limited. I know Gidget was also talking about her having 14 positions that she needs to fill, but only has like 9 desks and 9 spots for people to go. So we're kind of bursting at the seams out there for space inside and the space outside. And I think as we continue to fill these positions, we've been doing a really good job filling those vacancies. So I think it'll continue to be, a sore spot, unfortunately.
Legislature?
Yeah, didn't we open the Roy Rehill parking space slot? I mean, what the hell? We still don't have adequate parking still?
Yeah, the parking lot was built to half the size that we originally requested.
And what do you attribute this parking problem with? Now, you mentioned the snow, and I get it, we can get a payloader out there and move that, but that's not the issue. The issue is, do you have more clients, or I'm paying for more clients?
Well, we have, so right now too, so seasonally, we have the onslaught of PEEP. So we have a lot more people accessing services. We have a lot more people accessing simply because you have homeless people who don't want to be sleeping out in the snow. So we have more of those issues. So we have more visitors to the location. Most of those folks do come by bus, thankfully. But we've dedicated a whole row out there now just for visitors. But unfortunately, it's just not enough. We have approximately 344 staff, but we have 214 spots, right? So plus the additional 20 that the overflow lot gave us. So it's just, we have more people driving to work like you, than we have enough space within the building or for parking, and people are parking illegally. They're parking on the streets. They're parking at the end of roads where people can't get out. So yeah, it's been an issue for a long time, but I think Phil has said to me that he's working on a remote policy and looking into those avenues. I've been advocating for that with him as well in my talks, because we do have some positions that would work well with some type of remote capability. That would mean we don't have bodies they don't need to be there 5 days a week. Their cars don't need to be there. We have issues with, the county cars. If staff, last week we had 13 staff go out of town to a conference for 4 days. That means those 13 staff vehicles were parked there for 4 days, taking up spots. So we have other things that seasonally and occasionally create more issues for people that create frustration.
Now, you mentioned that, and correct me if I'm wrong, maybe I just misunderstood it, because I'm just a poor farm boy, don't know. But you said you have X number of positions, but you have 9 empty desks. Did I catch that correct?
So we have 9 available spots, but 14 positions. So
let's worry about those 9 first.
Yeah.
I don't care about the other 5 right now. You've got 5 placement areas for people. That's what you got to fill.
Yeah.
Then we'll worry about the other ones.
Yeah. So we have nine spots still available downstairs where she has office desks that people aren't sitting at. We have 15 positions to fill. So once those are filled, then that again would just exacerbates our situation when we don't have a remote policy and staff are expected to report to work. So I think that we need to continue to look at having policies that, especially for our facility, unless we're talking about satellite locations opening up where we can offload some of those staff to satellite locations so that they're all not reporting to that site.
Pretty good stagger. You staggering start times?
We do, but not too much, because during the winter we do have the plow operation, which has become another sore spot, because if staff get there too early and they don't have the time to clear out the lot, then they have to plow around vehicles, and then we get complaints because cars are literally snowed in and staff have to shovel themselves out of the parking lot. So we have to be careful to not allow the time frame to impede the plower's ability to get in there and plow the lot.
Now, do you have people also that start on the road, for example, say Joe Smots lives in the other side of Hastings, in Hastings somewhere.
Well,
Okay,
we
and he's
do,
gonna be doing Constantia that day, and like, I don't want him driving all the way to Mexico just to drive there. Put him right on the road.
yeah,
Because you have everything, I know you have all the equipment in the cars now, so they can send that information forward.
I'm not sure about what equipment you're talking about.
Well, I think he's referring to the Northwoods, and the laptops.
Oh,
Yeah,
okay,
yeah.
okay. So our staff, and Sarah can correct me if I'm wrong, when it comes to, folks who are traveling on the road, we have, partnered with some of the other county buildings for our vehicles, because we do want the staff to be driving the company vehicles and not their personal vehicles.
Correct.
So if they're parked at DSS, they have to come to DSS to pick up the vehicle, because they're putting hundreds of miles on these vehicles. So certainly staff don't want to use their own vehicle, especially if they're leasing. But what we've done is if they can park at the county lot here or other locations, the Fulton EMO office, we have some agreements where they allow our teams to park our county vehicles there, and then the teams can drive to those locations, pick them up, so that they are working in areas. Sarah, you might be able to speak more to how the schedules are set up for the teams with regards to the areas that they work at.
Yeah, so as far as the caseworkers are concerned, they can work what we call AWS, so they can pull over and do notes in their cars. They do have their laptops and their cell phones. They also can go to other sites around the county. They're not allowed to work from home, but they don't have to come back to the office. Sometimes they have to if they need paperwork or they need something printed or they have to talk to a supervisor or stuff like that. But
AWS is alternate work site.
Yeah.
So this
Sorry,
building
thank
could be considered an alternate work site, as long as it's pre-approved. They can, stop there, get their respite, do what they need to do, get on their laptops, and then head out, just so that we are reducing that mileage back and forth.
and we
after every
encourage them to plan their dates too.
Yes.
You know, if you have 3 home visits, go do your home visits and then come back. Don't go do a visit, come back, go do another visit.
No, I understand, that's
So-
logic.
Yeah.
Nicole, did you want to speak to the report you handed out?
Yeah, I don't want to take up a bunch of people's time. There's not anything really earth-shattering in there. It's just the updates through the end of the year. One of the things we have made some changes in regards to some of our contract oversight and looking at performance. We did make some changes in 2024, and we have some, going to be looking at some additional assessments of some of the performance of our contracts, partly using the process that Lee had mentioned earlier. But other than that, there's the crisis card. I just wanted to share we just prepared those. That QR code on the one page takes you to a dedicated page on our Mental Hygiene Division's website that lists additional crisis services. So we just finished getting those printed up. If anybody would like to have additional cards, let me know and I can get them for you.
I'd like some too.
Okay.
Perfect. Okay, so back to Sarah. We already did vote to approve the appointments to members of the OFA Advisory Council and the prescription medication drop box.
Thank you for that. Does
You're
anybody have any questions of me on that? I appreciate you passing it without my input, but does anyone have any questions on that? For the medication drop box, I think it'll be a great addition to our building for our seniors to be able to come in and just dispose of their medications appropriately so they're not out in the community, as well as sometimes people flush them down the toilet and those items are being found in the water system. So thank you for that. When I'm passing out right now, I don't have a lot for my update, but we are soliciting nominations for our volunteer of the year. So in there is just an informational memorandum as well as an application if you know anybody in the community that does great service for the area of the county where you are. Certainly nominate them. We're able to provide or promote 2 names to the state to be recognized at the state level, but any names that we do receive, we do recognize them locally as well. We don't exclude anyone because it's great work that all of our older residents do in the community, and without their volunteerism, things just would be lacking. So if you do know of anyone, please feel free. It'll be on our website as well, so that application can be downloaded. But we also in there, I just provided a little information about our 2019 through 24 meals, showing what it was pre-COVID to where we are as of last year. So pre-COVID, annual meals, both home delivered and congregate, was 243,692 meals. And of course, 2020 bumped up dramatically. Then it started leveling off or coming back down. But then you see 2023, the numbers, they start to go back up again. And last year we had another increase. That there's a number of reasons. The number one is there's more people that are age 16 older that can access the service. Also, the cost of food. So people are finding it very difficult to purchase their own food, and health outcomes. So there's a lot of people who can't prepare their own food. Maybe they don't have any family members. So that number is going up. We just see that number of individuals continue to increase, like the number of people that are requesting those meals. So just wanted to give you that information. And then I had provided transportation information for the Transportation Advisory Council, so I thought I'd give you that as well. Both the transportation to our dining centers, and these are just comparing 23 to 24, as well as our go-go grandparent transportation. And that is medical transportation. Last year, it was primarily out of county. We did have one individual that had required 3 days a week to go to cancer treatments here in Oswego, and we did accommodate him to be able to utilize the go-go grandparent transportation for those medical appointments as well. We haven't received our official notification of what we received for 2025, but I think it's been alluded that it's a substantial increase in the amount of funding we'll have for that. So we're looking to open it up more for more in-county medical transportation as well, because although there is access Oswego where our elderly can utilize it at no cost, sometimes the wait on the bus, waiting for it to come back, it can be a little bit longer, as well as some people don't like getting on and off the bus. So we have had a number of people that have requested it that are non-Medicaid, again, this is medical non-Medicaid, requesting to be able to utilize it within the county. So we're looking, depending on how much funding we receive, we're looking to open it for that as well. And I just wanted to, so for our Santa for seniors, we had limited it to 50 people. We ended up doing 72. And all of the higher, for the actual gifts, but all of the senior buildings, they all received a bag. So the gifts were bigger items, 2 to 3 items that they got. But for the senior buildings, because in 2023, we had a number of people say, well, how come I didn't get a gift? Because they saw their neighbor receive a gift. So to give everyone in the senior buildings a gift, it was just a smaller bag. There was a game book, pens for the game book, some tissues, hand sanitizer. Some of them received a blanket from the Alzheimer's Association that they donated, just a nice little fleece blanket, flashlights, batteries, a little sewing kit. So they all received, almost all the buildings, or all the tenants in the buildings received those gifts. So those are another 800 on top of the 72 that we did for individual gifts. Once we have when we move to our space next year, we're hoping to bring it back up to before we moved in 2023, it was over 150. We gifts we got out in the community. So I don't know if we'll get that high again because we're going to try to remain with the senior buildings with a little get bag for everyone. But we'll bring those numbers back up again once we have the space. And that's the other thing. We're just patiently waiting to be able to move into our new space. I'm sure Brian is patiently waiting too, since I'm in his conference room. But it's getting close. It's looking. I'm getting really excited to be able to move into that space. And the new space will have for new members that will have a congregate dining center in there. We'll also have a computer lab and space where other agencies can come in and provide information for our elderly as well. So, let's see, Medicare open enrollment, we had just the one counselor most of the season. We did get through it. It was a difficult time with just one, with the number of people that are looking to seek, have assistance with determining the Medicare Advantage plan or Medicare prescription drug plan. We do have a new staff member hired and they're getting trained right now, but it does take a little bit of time for them to be up to speed with all the ins and outs of the plans that are available. But they will be ready with open enrollment next year. And let's see, I think that was it.
Perfect. So the last item on the agenda is financial reporting, and everyone was provided a year-to-date available budget report. So what I'll do to save some time, are there any items in the year-to-date report that any department would like to point out, or if Bill or Veronica have any flashpoints that they see are going to be an issue? Anything that stands out?
Haven't spent much yet.
Okay. I see that.
I just wanted to bring to point, when I did my budget this year, the mileage was broken out. So if you look at my mileage line, it's only $2,000 and we've spent $800 of it.
Okay.
But it's going to be going to project lines. I'm working with Veronica and Robin on how to get that established. So it does look like we're pretty close to being maxed out already after one month, but that $2,000 is just for general OFA, going to make a deposit, and their program travel will be in their project lines.
So anyone have any budget issues? Any questions from the legislators on those? The last thing I wanted to talk about is actually the other hat that I wear in my assessment position. I want to be sure that your offices, the Veterans Office, Office for the Aging, and DSS generally, are providing your constituents with information on the available property tax exemptions for veterans. There's two specific exemptions available. One for, we have a senior exemption, low income based, and then individuals with developmental or physical disabilities regardless of age. And it's all based on income. The veterans is not. So if anyone would like information on those so that you can actually actively, educate your constituents, I want to be sure that we're working together, because I don't recall ever having anyone from any of the offices reach out to us directly for information or to refer people. So I want to make sure that that's an open line of communication.
I would love to have some additional information. We have been assisting people with completing or obtaining their information and directing them to their assessor if they need to go to their assessor. But any information we have, I'd like to.
Perfect. At least for the city, we have a lot of individuals that are on those exemptions, so it would be helpful to work together.
Yeah, absolutely.
Yeah. Anything from any legislators? Okay, I'll take a motion to adjourn. Second. All in favor?
Aye.
Who's got the information?